Good afternoon, everyone, and welcome. On behalf of UMass Boston Department of Nursing, I would like to welcome you all. My name is Annie Gakumo. I'm the Department Chair of Nursing. I would like to introduce our speakers for today. Dr. Suha Balu, who is an assistant professor in the Department of Nursing, as well as Dr. Linda Dunphy, who is the Director of Health and Wellness at University Health Services. So I'd like to thank you all on behalf of Dean Linda Thompson, as well as on behalf of Rob Pomalis at the University Health Services. So let's give a warm applause to our speakers.
Thank you. Okay, thank you everybody for coming. And the reason we wanted to talk about the coronavirus, or what we now call it as COVID-19, is because it's something that has been in the media and everybody's talking about it and some are worried. And as nurses, we wanted to do what we do best, is to educate and provide accurate information to our community here at UMass Boston. And we partnered with University Health Services because they do have a lot of resources that you can at the end ask about if anybody is worried or has any questions about their own health. So the coronavirus, or COVID-19, got a new name yesterday by the WHO. And CO came from the coronavirus, and the name corona came from how the virus is shaped. V is for the virus, D is for the disease, and 19 because this virus surfaced in December of 2019. If we look at the map and where do people the people that are currently diagnosed with being carriers of the virus are, they're in two main provinces in China, and there are some people around the world, but not many. So the virus has been mainly contained in two provinces in China. And that is where a lot of the very sick and the very ill people have been in that area. People internationally have been carriers of the virus. They might have had flu-like symptoms, but we have not yet documented any major illness outside that area. And this map was put out by the WHO actually yesterday, so it is pretty recent with the information. So coronavirus is not something that is new. It is a shell, for those who like to know, of a group of viruses that have been around since the 1960s. They are viruses that infect many animals. There are 4 of these viruses that we all have been exposed to at least once, if not more, in our lifetime. We don't die from them. The newer ones that have been documented were like the SARS a couple of years ago, MERS, and now we have the COVID-19. Most of them are not dangerous, but if somebody's immune system is not ready to be receiving a virus and have the flu, that's when they would have many complications. So this virus, how did it get to humans? This virus has been known to live in bats. So the host for many years of this virus has been in bats. And in one province in China, that virus was transmitted to humans. That virus was investigated to see how did it get to humans. There were no bats, and there were nobody eating bats in that area of China as per the investigations that happened. So most likely the thoughts are that some animal ate the bat, and that animal was ingested by humans. And so there are lots of studies for those who do work in what could be that host, and there were suggestions that it could be snakes. We still have no confirmation, but these are what the current findings are. So when we talk about the coronavirus, almost everyone has the main family coronavirus infection at least once, if not once a year in their lifetime. People get exposed to the flu almost every year. In some countries, it's a year-round thing. In the US, especially here in the Northeast, we do have seasonal flu seasons, like we are now in the middle of one of them. And anyone who has a low immune response, anyone who has comorbidities like cardiac disease, kidney disease, or are at the extremes of age, very young or very old, are at a high risk of getting sicker when exposed to any flu. And this is just one of them. So how do we protect ourselves? You know, in healthcare and in nursing, we always talk about prevention first. So the best way to be healthy is to prevent ourselves. And hand washing, as simple as it sounds, is the number one thing that we can start doing all the time, every day, multiple times a day, almost as soon as we think we have contacted any hard surface or any surface that could be contaminated, not only from the coronavirus, but because we are less likely to be encountering the coronavirus around here from any virus that could cause the flu or any other illness or virus that could be transmitted through hard surfaces. Also, washing the hands, it's not just opening free water and putting them soap, water for 20 seconds. 20 seconds may sound like a split of a time frame. It's a little bit of a long time when you're trying to wash your hands. So people have used methods like when we teach nursing students on how to wash their hands, or little kids when we start talking about hand washing. You know, we either sing the happy birthday song twice or we count to 20, those who don't want to do that. But it's a long time for hand washing to wash for 20 seconds. So that's one of the ways to start practicing proper hand hygiene. That's very, very protective. It's cheap. It doesn't cost anything, and we can do it. Or use alcohol sanitizers. I mean, I teach about health and illness all the time. And when all this conversation about coronavirus came out, I asked in class if everybody is walking around with a hand sanitizer. Very few of us do. So these are things that, instead of sitting there worried about what others can get to us, this is how we can protect ourselves. Um, we could wash our hands and keep them clean, but also avoid putting our hands in our eyes and in our mouth after we touch doorknobs or rails going up and down the stairs or at the train or anywhere else. Avoiding contact with people who are infected is also something. Thinking about where we were, have we traveled, have we not, were we in the areas that are known to have um, high prevalence of the virus or any similar virus. This virus does not discriminate, so anyone, it doesn't have to be somebody from a certain area, anyone who could have been close proximity to somebody infected could have the coronavirus. Avoid touching the eyes and nose and mouth with unwashed hands. And when we're sick, or if we think we are sick, we should stay away from others. So stay at home, call our primary health care or the University Health Clinic if you're affiliated with UMass Boston, and tell them about our situation before starting to go around and trying to spread the virus around. When we cough and sneeze, there are etiquettes, like coughing and sneezing to everybody and sharing the wealth of viruses is not the right thing. Coughing in the sleeve, not on the hand, and then shaking somebody else's hand. That's also a way to protect ourselves and others. And clean and disinfect frequently any objects we touch often. So for those of us who work at an office, how many times do we come and disinfect our offices? How many times do we disinfect our phones? We put them anywhere and everywhere, and then we use them, and then after we use them while we're eating. So these little small tips could help us a lot. So to go back to our coronavirus, for those of us who want to know the mode of transmission, it's through what I was just talking about. It's through touching an infected person's hands or face, touching things that, such as doorknobs, that have been touched by infected people who have had coughed or had used their butt secretions that would have had the virus. It is airborne, so it does travel through secretions and through the air. Coughing and sneezing, close personal contact with somebody who's sick. So if we want to give some advice for those individuals without any respiratory symptoms, somebody who does not think that they are sick, so they should avoid closed, crowded spaces, especially if there's somebody there sick. That is one way to feel like somebody is protecting themselves. Maintain at least 6 feet from an individual who has respiratory symptoms. So if you see someone coughing and sneezing and sick somewhere, just try not to be very close to them. Perform hand hygiene. Proper coughing and sneezing techniques. Don't touch the mouth and nose after touching any hard surface. And the medical masks are usually not required for somebody who does not have symptoms and does not think that they are in a proximity with somebody who is sneezing at them. So going out there and buying masks is really unnecessary unless it was required by a healthcare professional. Individuals with respiratory symptoms, The symptoms of the coronavirus are like any flu. So somebody who's feeling generalized tiredness, fever, coughing, difficulty breathing, they can call their primary healthcare provider and get any advice. A lot of the treatment options are the same treatment options for any flu, so there's nothing specific to the coronavirus yet. This is more about the symptoms. So what we tell people with the flu is just you have to drink plenty of fluids, get plenty of rest, have proper nutrition so that their body is strong enough to heal. There are over-the-counter medications that usually help with sore throat so that people can actually continue to drink and eat, that help with decreasing the temperature. Sometimes a humidifier or shower can help with congestion. And then call the university health service or primary care providers to talk about the symptoms, make an appointment. Don't just go and stay and hang out saying maybe somebody will see me, just to try to decrease any unnecessary transmission. So this was something that I found on the WHO website, which was interesting. And these questions I have heard about from my students and from others, like some of those myths that are traveling around. We like to ask questions sometimes. Is it safe to receive a letter or package from China? Yes. The virus is airborne. It doesn't live in a package. You won't receive socks that would have the coronavirus or books or whatever we are ordering. Can spraying alcohol or chlorine or over somebody's body kill the new coronavirus? No, it can't. That's not how it works. If we wash our own hands and practice proper hygiene ourselves, we will be fine. Can pets at home spread the new coronavirus? We don't know. There is no evidence yet that pets at home will transmit the virus or even may get it. Do vaccines against pneumonia protect you against the new coronavirus? The vaccines against pneumonia are for pneumococcal vaccines. They help the body against pneumonia, not necessarily the coronavirus. Can regularly rinsing your nose with saline help prevent infection with the new coronavirus? No, has nothing to do with that. Are there any specific medicines to prevent or treat the new coronavirus? It's just like any flu. There are still no vaccines for it. There will be with the next cycle of the flu vaccines. They are working on something, but now there isn't. And treatment is just the regular flu treatment, symptom management. It's a virus. It does not need antibiotics. So no need to go around and take any antibiotics. And does the new coronavirus affect older people, or are younger people also susceptible? Everybody is equally at risk of getting the virus if getting in close proximity to somebody who is carrying the virus. Younger and older people may have a weaker immune system. That's why they may be sicker. But if vaccinated for the flu vaccine and if they're healthy and their health is well maintained, they may not necessarily get very, very sick as compared to anyone else. So, a take home is it is just like another flu. Our body's not used to it. It may make us feel sicker. It is not specific to any population. So practicing the proper hand hygiene, getting our flu shot, and maintaining health, that would be what would protect all of us. We have here Linda Dunphy from University Health Services. If anybody has questions related to what they are doing to help protect us at UMass.
From 8:30 till 7 p.m. Monday, Tuesday, and Wednesdays until 5 on Thursdays and Fridays. We have 24-hour, 7-day-a-week phone coverage when we are not open. We're located in the Quinn Building. Probably most of you know that. Okay, no questions? Yes.
Hi, I just have a quick question about the use of hand sanitizers. I've heard that they've been overused, could potentially be overused and create stronger, I guess, viruses. I didn't know if you want to talk about that, or is it, yeah.
Hand sanitizers usually clean the surface that if you're cleaning your hands, they clean your hands after you have touched something. So they have no impact on the viruses that are available or not available.
Hi, my name is Haeok. I happened to be in South Korea last semester because I took my sabbatical in Korea. I came to United States January 15, and I just wanted to bring some issues about regarding coronavirus in case some some sensitive about some issues related to stigmatization from certain ethnic group. Since, as you mentioned, we do not know how it started, right, the virus, and we have so many rumors about certain ethnic group eating certain wild animal, but this is not really true. As you mentioned, because in the United States, 2018, close to 10,000 people died, mortality to influenza, right? But there is no mortality from coronavirus from the United States. Less than 20 were confirmed with the diagnosis. Well, we have millions of people diagnosed with the flu. I just wanted to share with you, we are too sensitized to this one. And particularly, as you mentioned, is many cases in South Korea, in Japan, there is no mortality. Because as you said, simply, this is just diagnosis, but does not mean it's mortality like Ebola virus. So I really appreciate this kind of forum we can share. But meantime, I'm able to little bit speak up because since I'm not Chinese, but I just noticed my colleagues about from this country kind of really something is kind of restrained from speaking up. And some case in Italy and all the Asian students are not allowed to come into school of this one. So I hope we do not need to repeat this one. I just wanted to share with my colleagues, coronavirus just like a flu. We just human nature. If we do not know anything, we're just kind of scared to death. But we know the flu of this one, so not too much desensitized of this one. I'm from just Korea. I happen to be here, share with you, and any healthy people, no one died from coronavirus. So we are all healthy here. To not afraid of a little bit coughing because simply being an Asian, when I have sneezing, I'm kind of afraid how people see me. So that is how we are certain way discrimination against other, some ethnic group, other one. Sorry about wrong introduction, but simply I was in Asia, now in the United States. I see the two oversensitized news around here, particularly UMass Boston, we have one student. Why we wanted to know too much about the students about this, right? So thank you for your listening.
Thank you, Dr. Lee, and thank you for sharing a very important point. And not everybody wearing a mask may necessarily be sick. As the WHO explains on their website, there are certain cultures where it is only respectful if somebody thinks that they might be sick, that they would put a mask, and that is because that's part of their civil duty to the society that they live in to protect others, that they may or may not be sick. And so not everybody with a mask around campus or around the city might be sick. They might just be a cultural habit. Just to be mindful not to end up, instead of doing good, hurting others, discriminating against certain ethnic groups.
Hi, I'm Kim Hamad Shifferly over in engineering. I was just curious how the student is doing, the one that was infected, and when they'll be returning.
It's my understanding that the student is recovering, and we don't know when that student will return to classes.
I think this is very HIPAA confidential information, and university level, there's no kind of right or authority to share anything, and we do not have any right curiosity to know about the consequences, right? Just like coronavirus diagnosis and flu diagnosis about the same, and we just respect individuals' decision.
So are there other questions or comments in the crowd? Any other questions or comments? Are there any closing remarks before we conclude?
Yeah, just to say, like, if somebody has any form of flu, they're usually contagious the first few days, and thereafter, throughout recovery, they stop being contagious. So, anyone who might have been sick, they say they stay at home for the first maybe 3 to 5 days. And then, even if they have residual symptoms, sometimes there's hoarseness, or sometimes there's tiredness, or there's still some runny nose. If they're in public, they are not contagious anymore. A lot of times people are contagious before symptoms start arising too. So it's the first 3 to 5 days that are usually critical. And it's not only for coronavirus, it's usually for most upper respiratory viruses. So after a couple of days, people can go back to work, can go to the grocery store, as long as they're practicing proper hygiene, everybody will be fine.
So I'd like to give our speakers a round of applause. Thank you both. We did think as a college and of course University Health Services, and I know they've been actually having forums on this as well previously, to just continue to keep that means of communication open, just because there's so much information out there, information/misinformation, right? And so it's important for us as a community to continue to have forums such as these and continue to, communicate with each other and ensure that, we are knowledgeable and in the know about, what's gone on, what's to come, and how we can best help protect ourselves, protect others. And also, I really think it's important to bring in that element as well, that we don't stigmatize others. Very highly important. So so there are different aspects of this to have conversations on, and I'm glad that we can continue the conversation. So we look forward to talking to you again soon, and thank you for coming.